Welcome to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. Note, the views on the podcast represent those of my guest and I.
Purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice or medical suggestions. Please see your local board and state-certified health professional. The views of this podcast represent those of my guests and I.
So you're prepping for a telehealth OSCE.
Yeah.
And let's be honest, it can feel a bit different
It really can.
than a traditional OSCE, but no worries.
Exactly.
We've got you covered today.
Absolutely.
This deep dive is like tailor-made for those VTE questions.
Totally.
We've got this amazing lecture from Dr. Runkit Watanakul at Howard University.
Mm-hmm.
It covers everything VTE, from
Okay.
prevention to treatment.
It really does.
Plus,
Yeah.
we've got the guidelines from the American Society of Hematology
For sure. For
to give you that extra confidence boost.
That extra layer.
Yeah, exactly.
Exactly.
It's like having a cheat sheet for one of the most common issues
Oh, yeah.
that you'll face in telehealth.
For sure.
So our mission today is to help you not only understand the ins and outs of VTE,
Yeah.
but also to shine when those tricky OSCE questions come up.
Absolutely. And think of us as your OSCE coaches.
Yeah.
Walking you through all the key takeaways from the lecture and guidelines.
Let's jump right in.
Let's do it.
The lecture starts with this scenario that's ripped from a telehealth OSCE.
Okay.
85-year-old woman
Okay.
with COPD and pneumonia
Mm-hmm.
calls in with a swollen arm.
Oh, no.
And guess what? It turns out she has a DVT.
Classic presentation.
It is.
And this is exactly why VTE is so important for telehealth providers.
Yeah.
You have to be so sharp picking up on those little cues
Absolutely.
during the virtual assessment.
Totally. And to really understand VTE, you need to know Virchow's triad.
Oh,
Like the back of your hand.
like the back of your hand.
And the lecture does a great job explaining this concept, alterations in blood flow,
Right.
vascular endothelial injury,
Yes.
and a hypercoagulable state.
The recipe for a clot.
It is.
Yes.
The recipe for clot formation.
Exactly.
And recognizing those three things in your telehealth patients is crucial.
Oh, crucial.
So think about this.
Yeah.
You're in your OSCE,
Okay.
and the examiner throws you a question like,
Mhm.
what are the risk factors for VTE?
Oh, yeah.
You'll be ready. You'll be ready to hit them with everything.
All right.
Recent surgery,
Yep.
immobility,
Mm-hmm.
history of clotting disorders,
For sure.
even medications like hormone therapy.
And don't forget those genetic predispositions.
Oh, yes.
The lecture mentions factor V Leiden
Yes.
and prothrombin G202010A mutation
yes.
as key players in VTE risk.
There are key players.
Huge.
Huge.
Yeah.
And the lecture gives this great reminder about estrogen therapy
Oh, yeah.
and chemotherapy
Oh, right.
as potential risk factors.
Big ones.
It's easy to overlook medications
It's
when you're focused on the medical conditions, but they can be huge contributors to that hypercoagulable state.
absolutely. And remember, in a telehealth setting, you're really relying on that patient's history
You are.
and their ability to describe symptoms.
Yeah.
You don't have that luxury of a physical exam
Right.
like you do in the traditional setting.
Right.
So really honing those history-taking skills is essential.
That said, okay, so
Yeah.
the lecture also dives into
Yeah.
risk assessment tools, like the Wells score
Yes.
for PE
Yeah.
and the revised Geneva score.
That's right.
These are like gold
We're so good.
for figuring out the patient's pre-test probability of having a PE.
But that's something your examiners are going to be looking for. They want to see that you can think critically
Yes.
and apply these tools to real-world scenarios.
Yes.
It's not just memorizing the scores.
No.
It's about understanding how to use them.
Exactly. Okay, so you've assessed the risk factors,
Okay.
and maybe you're starting to get a bit worried about your telehealth patient. So the lecture really emphasizes
Yeah,
VTE prevention,
absolutely.
especially in the hospital setting.
Especially there.
And it provides specific
It
examples
says.
of low, moderate, and high-risk patients
Yes.
and the corresponding prevention strategies.
This is such practical knowledge
It is.
that you can apply directly in your OSE.
Exactly.
Yeah.
So, like, a low-risk patient might just need encouragement to get up and move around,
Exactly.
while a moderate-risk patient might require low molecular weight heparin.
LMWH.
Yeah.
Or SCDs.
Yeah, or SCD.
Sequential compression devices.
Exactly.
Love those.
And for high-risk patients,
Yeah.
you might need a combo of approaches.
You might.
So the lecture highlights the importance of clinical judgment,
Oh, for sure.
especially in telehealth,
Especially in tele.
where you're making decisions
Yeah.
based on limited information.
Limited info.
Okay, so let's say you suspect
Okay.
your telehealth patient already has a VTE.
Oh, no.
What are the red flags
Okay.
you need to be on the lookout for during that virtual assessment?
Okay, so for DVT,
Yeah.
you're often looking for unilateral swelling, paint redness in the affected limb.
Right.
But you have to be a telehealth detective.
Yes.
Asking really specific questions about the location, the timing, the severity of the symptoms.
Exactly. And for PE,
Yeah.
think chest pain, shortness of breath,
Yes.
even coughing up blood.
Right.
But remember, you're relying on the patient's ability to articulate
Totally.
what they're feeling.
You are.
So clear communication is
Yeah,
key.
it is so key.
So once you suspect a VTE,
Okay.
it's time to think about diagnostic tests.
Yes.
The lecture covers the whole spectrum.
It
The
does.
D-dimer blood test
Yeah.
to lower extremity, Doppler ultrasounds,
Mhm.
ventilation perfusion, VQ scans,
Yep.
and CT pulmonary angiography,
It is so TPA.
ETPA.
Yeah.
I remember from the lecture that D-dimer can be a bit tricky.
Oh, yeah, it can be.
It's great for ruling out a clot
If it's negative.
if it's negative.
Totally.
But a positive D-dimer doesn't necessarily scream VTE.
It doesn't.
It could be elevated for other reasons.
Right. So many reasons.
So that's where the concept of pretest probability comes in.
Yeah.
Knowing the patient's risk factors and clinical presentation
No.
helps you interpret that D-dimer result
Exactly.
accurately. Speaking of pretest probability,
Yeah.
the lecture mentions post-test probability.
It does.
As well.
It does.
Basically,
Yeah.
it's how the results of a test change the likelihood
Right.
of a patient having the condition.
It sounds complex,
It does.
but it's really just a way to think critically
Yeah.
about how the info from the test influences your assessment.
Okay, so let's say you've confirmed the diagnosis of VTE.
Okay.
Now it's time to talk treatment.
Yes,
The lecture does a fantastic job
it does.
of breaking down all the different anticoagulant options.
So many options.
There are a lot.
A lot of options.
We've got unfractionated heparin, UFH,
Mm-hmm.
low molecular weight heparin, LMWH,
Yep.
warfarin,
Yes.
and those newer direct oral anticoagulants,
The DOAC.
the DOACs.
Yeah.
It can feel overwhelming,
We can.
but we'll walk you through it.
We
We'll
will.
walk you through the key points for each one.
Let's do it.
So let's start with heparin.
Okay.
The lecture mentions both UFH, which is given intravenously,
Right.
and LMWH,
Right.
which is given by injection.
Okay.
They're often used in the initial phase of treatment,
Mm-hmm.
especially for hospitalized patients.
Especially there.
And one of the crucial things to remember about heparin
Yeah.
is that it requires monitoring.
It does?
The lecture talks about checking APTT
Yep.
or anti-azad levels
Right.
to make sure the dose is right.
It's all about that sweet spot.
It is
Right.
too low a dose,
Yeah.
and the clot might not budge.
Exactly.
Too high a dose,
Yeah.
and you risk bleeding.
Too risky.
It's a delicate balance.
It is.
And being able to explain that in your OSCE
Yes.
will show them that you understand the nuances.
Exactly.
Okay, so warfarin.
Oh, warfarin.
Now, warfarin is a completely different animal.
Completely
It's
different.
a pill,
It is.
but it is infamous
Oh, yeah.
for its interactions
So many interactions.
with other medications
So many.
and even certain foods.
And-
Warfarin is also notorious
Yeah.
for its interaction
Mm-hmm.
with CYP450 enzymes.
Right.
These enzymes are like little workers in your liver
Little workers.
that help process medications.
Hmm.
And warfarin can interfere
Oh, yeah.
with their work.
It can.
So it's crucial to be aware of those potential drug interactions.
Oh, yeah.
The lecture provides a helpful list
It does.
of medications that can either increase or decrease the INR,
Oh, yeah.
which is the test used to monitor warfarin.
That's right.
So thinking back to that telehealth OSCE,
Yeah.
imagine a scenario
Okay.
where your examiner asks you about managing warfarin
Mm-hmm.
in a patient who's also on antibiotics or antifungals.
Oh, good one.
You'll need to be ready
Okay.
to explain the potential for interactions
Mm-hmm.
and the importance of close monitoring.
Absolutely.
The lecture even mentions
Yeah.
how over-the-counter pain relievers
Really?
can mess with warfarin levels.
Wow.
Yeah, and let's not forget about vitamin K.
Oh, vitamin K.
Leafy green veggies are healthy and all,
They are.
but too much vitamin K can counteract warfarin's effects.
That's right.
That's why patient education is so important,
It's huge.
especially in telehealth,
Especially in telehealth.
where you might not have those face-to-face interactions.
Exactly.
The lecture stresses the importance of explaining things
Yes.
like dosage, potential side effects,
Yes.
and when to seek medical attention.
Oh, that's crucial.
Okay, speaking of patient education,
Yeah.
let's move on to those DOACs.
Oh, the DOAC.
The lecture highlights their advantages.
Okay.
Rapid onset of action,
Love that.
fewer interactions,
Fewer interactions.
and no need for routine blood monitoring.
Amazing.
They sound almost too good to be true.
They do.
They've definitely made VTE treatment more convenient.
They have.
But it's important to remember
Yes.
that they're not without risks.
Not without risks.
The lecture specifically mentions apixaban, rivaroxaban, edoxaban, and dabigatran.
All the big names.
It's all the big names.
Yeah.
Each one has its own quirks
It does.
in terms of dosing and indications.
Absolutely.
The lecture also points out
Mm-hmm.
that DOACs can still cause bleeding,
They can.
and while they have fewer interactions than warfarin,
Yeah.
there are certain medications
There
that
are.
can interfere
Yeah.
with their effectiveness.
Exactly.
So that's why it's crucial
Yes.
to review each DOAC's specific drug interactions
Yeah.
before prescribing it,
Absolutely.
especially in telehealth,
Especially there.
where you might not have access to a complete medication list.
Exactly.
Okay, so far,
Yeah.
we've covered risk assessment,
Yep.
prevention,
Mm-hmm.
diagnosis,
Yes.
and the main treatment options
Yeah.
for VTE.
We did it.
Feeling overwhelmed yet?
I feel like we did a lot,
Yeah.
but it was good.
It was good.
But we've got more to cover
We do.
in the next part of our deep dive.
We do.
Tackle those advanced topics that'll really set you apart in your OSCE
Okay.
perioperative management. Switching between anticoagulants and even reversal agents.
Okay. Stay tuned.
We'll be right back. Okay, so let's dive back into this world of VTE.
Right.
Specifically, those trickier scenarios
Yeah.
that might come up in your telehealth OSCE.
Mm.
Feeling ready to level up your knowledge, I am too.
Let's do it.
So let's start with a situation that can really make your head spin.
Okay.
Perioperative management
Oh, yeah.
of anticoagulation.
That's a tough one.
So imagine you have a patient on anticoagulation
Okay.
who needs surgery.
Oh, boy.
What do you do?
Right.
It's like walking this tightrope
It is.
between preventing clots and avoiding bleeding complications.
It's a balance.
It is a balancing act.
The lecture refers to this as bridging,
Bridging.
right?
Yeah.
And it emphasizes the importance of careful planning
Yes.
and monitoring.
Absolutely.
The lecture even gives this really helpful example
Okay.
of bridging with warfarin
Mm-hmm.
and enoxaparin. So you stop the warfarin a few days before surgery,
Okay.
start the LNWH injections, the enoxaparin,
Yeah.
and then restart the warfarin
Okay.
after surgery,
Right.
overlapping with the LMWH.
Okay.
until the INR is back in the therapeutic range.
Back in your range.
It's a delicate dance.
It is a dance.
Of timing and monitoring.
It is.
And knowing these specific protocols
Yeah.
will really show your examiners
Absolutely.
that you understand perioperative management.
For sure.
So it's like having a choreographed routine,
I like that.
right, to make sure the patient's protected
Right.
from both clotting and bleeding complications.
Exactly.
So we've mastered bridging.
Okay.
But what about switching
Okay.
between different types of anticoagulants?
Yeah.
When might that be necessary in a telehealth setting?
Oh, that's a good question. So
Yeah.
imagine a patient who's been managing their warfarin
Okay.
with regular INR checks at a lab.
Mm-hmm.
But now they're transitioning to a more remote setting. Switching to a DOAC that doesn't require that monitoring
Yeah.
could be life-changing for them.
That's a great example
Yeah.
of how telehealth can really influence treatment decisions.
Absolutely.
The lecture also mentions renal insufficiency
Oh, right.
as a reason for switching,
Yeah,
because some medications are affected by kidney function.
they are.
And let's not forget patient preference.
Oh, right. Of course.
Some people might have difficulty with injections.
Yeah.
So a pill form DOAC would be a better fit.
Much better.
And cost can be a factor too.
Oh, for sure.
DOACs can be expensive.
They can be.
So the lecture provides clear recommendations for transitioning
It does.
between different types of anticoagulants. For
Mhm.
example, when switching from LMWH to warfarin,
Okay.
you start the warfarin a few days before stopping the LMWH
Okay.
to ensure a smooth overlap.
I see.
And when switching from warfarin to a DOAC,
Okay.
you typically start the DOAC when the INR is within range, avoiding those unnecessary gaps in protection.
Smart.
Okay, so we've covered bridging.
Yep.
We've covered switching.
Mm-hmm.
But what if
Yeah.
a patient on anticoagulation
Okay.
has a major bleeding event?
Oh, that's scary.
That's like a telehealth provider's nightmare.
It's a nightmare.
It is.
Yeah.
It's definitely a high-stakes situation.
High stakes.
And that's when you need to know about reversal agents.
Reversal.
The lecture dives into this topic,
Okay.
provides valuable insights
Got it.
that could be game changers in your OSCD.
Ah.
So for warfarin, the antidote is vitamin K,
Vitamin K.
which can be given orally
Mm-hmm.
or intravenously.
Right.
But I remember from the lecture
Yeah.
that the intravenous form works much faster,
Way faster.
which is crucial in an emergency.
Oh, absolutely.
And for heparin,
Okay.
the reversal agent is protamine sulfate.
Protamine sulfate.
It binds to heparin
Okay.
and neutralizes its effects.
I see.
Now, what about those DOACs?
The DOACs.
For a long time,
Yeah.
there weren't any readily available reversal agents,
Right.
which made bleeding complications a big concern.
A huge concern.
Huge concern.
Yeah.
Thankfully, things have changed.
Yeah.
The lecture highlights the availability of specific reversal agents
Okay.
for some DOACs.
Awesome.
For example, divarasuzumab,
Didorsizumab.
Praxbind reverses dabigatran,
Huh.
and Dexinet alpha and Dex
Pegbantilgasa.
reverses the effects of factor Zaga inhibitors,
Oh, wow.
like apixaban and rivaroxaban.
That's good to know.
That's a huge relief.
It is.
It's reassuring to know
Yeah.
that we have more options
Absolutely.
for managing those bleeding complications.
For sure. But even with those reversal agents,
Yeah.
prevention and careful monitoring are still the best strategies.
They are the best.
They are.
It's all about being proactive
Yeah.
and thinking ahead.
Thinking ahead.
Now, before we move on
Yeah.
to the final part of our deep dive,
Okay.
let's pause for a moment and consider how these concepts might apply
Mm-hmm.
in a telehealth OSCE scenario.
Okay.
So imagine
Okay.
your examiner presents you with a case
Mm-hmm.
involving a patient on warfarin
Okay.
who needs a minor procedure.
Oh, okay.
How would you approach that situation?
That's a perfect opportunity
Yeah.
to demonstrate your knowledge of bridging.
It is.
You can discuss all those steps involved
Yeah.
in assessing the patient's risk
Yeah.
of both thromboembolism and bleeding.
Right.
You can use tools like the CHAJ2DS2 VASIC score for stroke risk
Mhm.
and the HASP-LAD score for bleeding risk.
Exactly.
And you can walk the examiner through the whole
Yep.
process of deciding whether to bridge or not,
Yeah.
explaining the rationale for each decision.
Right.
This shows that you can apply those evidence-based guidelines
Yes.
to real-world situations.
That's what they're looking for.
That's what they want.
And don't forget to mention those crucial patient education points.
Oh, yeah.
In a telehealth setting,
Mhm.
clear communication is paramount.
So important.
You want to explain to the patient
Yeah.
why they need to stop or adjust their anticoagulation,
Right.
what to expect during the bridging period,
Exactly.
any potential side effects they should be aware of.
It's all about connecting those dots
Yes.
and showing that you can think critically
Yes.
and apply your knowledge to those unique challenges of telehealth.
Okay, are you ready
Yeah.
for one last challenge?
Hit me with it.
So think about this with the rise of telehealth. How do you envision the future of VTE management?
Ooh, that's a fantastic question.
It is a good one.
And it's the kind of forward thinking that'll really make you stand out in your OSCE.
Yes.
Remember, those examiners aren't just looking for somebody who can,
Regurgitate facts.
regurgitate facts.
Yeah.
They want to see that you can think critically
Yeah.
and apply your knowledge to this evolving world of healthcare.
Absolutely. So how might telehealth change the game for VTE?
Okay, well, for starters, think about remote monitoring.
Okay.
What if we could use wearable devices to track a patient's mobility?
Interesting.
Or even detect those subtle changes in blood flow
Yeah.
that might suggest a developing clot.
That would be incredible.
Early detection
Yeah.
could be a game
It
changer
would be a game changer.
for preventing those serious complications.
Totally. And imagine the possibilities with artificial intelligence.
Mhm.
We might even see algorithms
Right.
that can analyze all this patient data.
Yeah.
Electronic health records, wearables, even social determinants of health,
Wow.
and flag those patients
Yeah.
who are at highest risk for VTE.
It's like a personalized
VTE.
VTE prediction system.
It is like a personalized
Yeah.
VTE prediction system.
Exactly.
That is mind-blowing.
It is mind-blowing. And with telehealth,
Yeah.
we can provide those targeted and timely interventions,
Yeah.
whether it's adjusting medications,
Yeah.
recommending lifestyle changes, or even arranging for in-person follow-up
Right.
when necessary.
This is really making me excited about the future of telehealth.
And me too.
It's not just about convenience.
Yeah.
It's about using technology
Yeah.
to improve patient care
Absolutely.
in ways we never thought possible.
I agree. As you prepare for your OSCE,
Yeah.
keep that big picture in mind.
Okay.
Don't just focus on memorizing
Right.
all those facts and figures.
Yeah.
Think critically about how telehealth is transforming healthcare
It is.
and how you as a future provider
Yeah.
can be a part of that evolution.
We've covered the A to Z's of VTE.
We have.
You're well on your way
Yeah.
to acing that telehealth OSCE.
You got this.
Remember to stay calm, think critically,
Mm-hmm.
and apply what you've learned.
And don't forget,
Yeah.
showcase your passion
Yes.
for telehealth. Let those examiners see your enthusiasm
Yes.
for this innovative field
Absolutely.
and how it can improve patient care.
Good luck.
Good luck.
We're confident you're going to crush it.
You will.
Purpose of these episodes not at all for advice or medical suggestions. These are aimed to provide support to peer pharmacists in training in educational and intellectually stimulating ways. Again, these are not at all for medical advice or medical suggestions. Please see your local board and state-certified health professional. The views of this podcast represent those of my guests and I.
Thanks for listening to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. We are so glad that you were able to tune in today. Note: the views on the podcast represent those of my guest, and I take care and all the best.